Can I have my slides, please? In the words of Albert Einstein, a picture is worth 1,000 words, they say. And when the words becomes unclear to express, it's the photograph which can make the expression clear. It's also said that it's the only language which can be understood anywhere in the world. Good morning and welcome. I'm Dr. Arun Kshetrapal and I welcome you all to our course on mastering ophthalmic photography and videography. Before I start my course, I'd like to acknowledge that most of the images are original and they have been clicked by the presenter himself. Few images have been taken from the internet and I have no financial interest in any of the matter presented. Let me introduce my instructors. Dr. Satish Sheth, he will be talking about mastering the subtle art of microscope videography. He has developed video capturing devices and he has developed on his own a lot of things for microscope DSLR cameras. Dr. Shishir Agarwal, he'll be talking about how to become proficient in fundus photography and unveiling the significance of ultra-wide photography. Dr. Suvin Bhattacharjee, he's a recipient of CS Reshmi Award and he'll be talking about the uncovering the craft of video editing and popular video editing software. I'm Dr. Arun Kshetrapal and I'll be talking about slit lamp photography. Ophthalmic imaging has changed dramatically in recent past. New sophisticated ways of acquiring images are now available with us, and this change has been possible because of the newer digital cameras coming in, the speed of processing becoming more and more increase in the speed of processing, and more space available for storage of data both locally and over the net. Ophthalmic imaging has played an important role in documentation and diagnosis of ophthalmic diseases and to record medical conditions. It has been used to track disease progression, teaching and patient monitoring as well. Just one word about history. In late 1800s, it was Jackman and Webster who described the technique of photographing the retina of a living human subject. And the next 50 years witnessed a slow advancement in instrumentation and techniques, probably because of the slow film speed, low exposures and inconsistent light sources. But with the advent of electronic flash and 35 mm photography in 1950s led to the era of modern photography. These are certain terms which I'll quickly go through it. Most of you know them, but just a bit. The focal length a focal length of a lens is the distance between the nodal point of the lens system to the sensor or to the film, and it is denoted in millimeters. The wide angle lenses usually have a short focal length but a wide angle of view. On the other hand, telephoto lenses will have a long focal length but a narrow angle of view. Lens speed, it is the widest aperture or the light gathering power of the lens. It is expressed as F number. I'm not going into details because maybe we can discuss this later. Depth of the field, this is very important. In order to get the depth of the field, you need to decrease the aperture. The narrower the aperture, more is the depth, and the wider is the aperture, the depth of field will be less. But if your aperture is less, you will need more light on the sensor. So either you'll need a flash or you'll want to open your aperture for a longer period of time to gather the sufficient amount of light. Then the shutter speed, it is the speed at which the shutter opens and closes, and it is measured by fractions of second. So a fast moving object would require a faster shutter speed, whereas a slow moving object or say maybe a nighttime sky, you can use a slow shutter speed, but a stable hand of course. Next is sensor sensitivity. It is the ISO number or the sensitivity of the chip to the light. One must remember that higher you go in the ISO number, the chip can capture in a low light, but at the same time there will be grains appearing in the picture or there will be noise in the picture. Digital imaging chips, the images are captured on the chip, and basically there are 2 or 3 types of chip. One is the CCD, or the charge coupled device, another is a CMOS chip, or the complementary metal oxide semiconductor, and a Fovean chip, which has been there for almost last 20 years, and it's slowly catching up. Then again, there are different types of file formats. Then 3 main file formats I'll be talking about: RAW, TIFF, and JPEG. RAW is basically the data which comes out of the sensor after capturing the image. It is basically unprocessed data which needs to be processed to make it a picture. Whereas TIFF is an uncompressed file. It has lot more information, and JPG is a compressed file. I'm not going into details because of the time. Now coming to the slit lamp photography. Basically, photography of eye would involve 2-3 things. One is the external photography. Another would be a smartphone slit lamp photography, which can be done with a bare hand, or you can use adapters for supported. Then you can do it photography through beam splitter, or you can do there's an integrated beam splitter and camera incorporated into one device. So external photography is basically for the gross lesions of the lid or the conjunctiva, or you can do external photography for the ocular movements before you do before you take the patient for the squint surgery. Coming to bare hand smartphone slit lamp photography. So what you do in this is the most basic type of photography, most crude type of thing to do. You just hold the smartphone in your hand, and you focus the lesion with the slit lamp, and then you align your smartphone to the eyepiece again, and you hold it against the eyepiece, and then you click a photograph. So the advantage is that it does not require any extra adapter, and no added equipment is required. But the disadvantage is that it requires a lot of practice to hold it steady, to center it. There's a learning curve in it, and images can sometimes be shaky and decentered, and there can be vignetting effects also. So just a small video of bare hand photography. What I'm doing is I'm holding the camera, and look how shaky it is. So if you even shake your camera by a millimeter, the images get shifted a lot because of the magnification factor. So you need real steady hands, or you need to stabilize your hand with something to click this photograph. Yesterday I was going through the exhibition, and I came across this particular device. This device, it gets attached to the slit lamp. It is 3D printed, and then you attach a camera on this. So this device works as holding the camera, what your hand used to do, and this can be shifted out. It can be rotated out of the field, out of the eyepiece, and then can be brought back to the eyepiece. Then there are adapter supported smartphone photography. They can be of 2 types. The adapter can be fixed onto the eyepiece, or the adapter replaces the eyepiece. So this is just a homemade device. You can do it yourself or DIY. So you take any cap of maybe a soft drink bottle or a betadine hand wash bottle. You drill a hole in between this in the center, and just see that it fits over your eyepiece snugly. And then what you do, you apply a tape on this, the 2-side adhesive tape, which has an adhesive on both the sides. So one side you adhere it to the cap, and the other side you adhere to the camera of the slit lamp of the smartphone. And so you will have this cap sticking onto the smartphone, and if you look from the other side, it will look like this. And now you can just put this cap on the eyepiece, and the phone will be supported there, and you can click images. Again, this is a very gross, very crude sort of a device. So how do you capture images? You set up the patient at the slit lamp, instructing him or her to maintain a fixation and stay as still as possible and not to move the eyes. Look through both the eyepieces, center the image and adjust the slit beam, and just see that this is the proper frame you want to take. adjust the focus on the subject matter, and then determine which eyepiece is giving you the best picture, whether the right or the left, and then you align your smartphone camera lens with the eyepiece that will produce the best image. Another way is to use this sort of an adapter, which is available on Amazon, and it is, I think, less than 1,000 bucks. So this thing you can fix on the eyepiece, and this is the place to fix your iPhone. But with the new iPhones having multiple cameras, you need to determine which camera is there for this. So for this you need to do trial and error, or you can block different cameras with your finger and see which is the best camera for slit lamp photography for your particular camera. So once you have fixed this device, then you fix a smartphone over this. Then next, the adapter replacing the eyepiece. In this, you take out the eyepiece of the slit lamp, one of the eyepiece of the slit lamp, and this particular part goes into the eyepiece socket, and you can fix an iPhone, any smartphone over it. So this goes inside the eyepiece. The biggest disadvantage of this is that your eyepiece is blocked. You will have uniocular vision. Best is to do a slit lamp photography through a beam splitter. Beam splitter, as the name suggests, it splits the beam. So there is basically a glass sort of a thing with a variable transmission of the light. It can be coated according to what percentage of light you want to get transmitted or to get reflected. So a part of the light is reflected, which can go to the camera, and the part of the light is transmitted through this piece, which goes to your eyepiece. And then at the end of your beam splitter, either you can attach a DSLR camera or a smartphone camera, or one of the 4K cameras which has recently been developed by Dr. Kankaria sir. In the end, maybe sir, if you can enlighten us about your recent 4K camera and where it will go. So it will be for the benefit of the audience here. So basically a beam splitter sits between the optics of the slit lamp and the eyepiece, and it has a place for putting up either a video camera or a DSLR or a smartphone, and of course it has a ring to fine focus the image. So this is how it looks without an eyepiece. Either you can attach a CCD camera, or you can attach a smartphone over it. This device is by Remedio. I have no financial interest in this. This is just for demonstration. They have a beam splitter and a smartphone fixed to this device, and then you can attach a DSLR camera as well over it, over the slit lamp, over the beam splitter. So here is the beam splitter, and there you need an adapter to convert that image, which is or to the rings or to the place where the optics or the lens of the lens is fitted onto the body of the camera. So this is an adapter, and there are many different forms of adapters available for different cameras. Camera can be incorporated into the beam splitter itself, and it fits in between the optics, again in between the optics of slit lamp and the eyepieces, and it is a more compact way of doing it. This is the eyepiece and this is the optics, and here the camera fits in. So this is the camera. This is by Appa and this is by Topcon. So here is again the optics of the slit lamp and the eyepiece, and this is the camera. Coming to the different forms of illumination, you can take a picture in a direct illumination or a diffuse illumination or an indirect illumination or scleral scatter, even retro illumination. So a direct illumination would be where your light beam goes directly onto the lesions you want to photograph, so highlighting that lesion. So this is the direct illumination. Or diffuse illumination will be where you don't have a slit beam and the diffused light illuminates the whole of the eye. And then indirect illumination, wherein the light falls onto the iris and the reflected light from the iris would eliminate or will define the object you want to focus on. So here if you can appreciate that there is a very small foreign body, so the light is here, it is falling onto the iris, and this foreign body is being illuminated by the light which is coming from the iris. Then there is a scleral scatter wherein you focus the light onto the limbal junction between the sclera and the cornea, and the whole of the cornea gets illuminated. And of course then there is a retroillumination, like, or a coaxial illumination. Then there is one more concept of background illumination. You see the difference between these two images. This image has been taken without any background illumination, wherein only the slit beam is visible and it's not producing a very good image, whereas this image has been taken with a background illumination, wherein you can see the other structures of the light as well as the structure which I want to highlight, the anterior capsular cataract. So this can be achieved in many ways. You can have extra source of light fitted onto your slit lamp. So besides the slit beam, if you open this aperture, there will be an extra light falling onto the mirror of the slit lamp, which will be get reflected. So if you look from the down, so the slit beam is coming from here and the diffuse illumination light is coming from this point of time. This will get blocked if I move this particular piece on this side. So this is one of the way to get a background illumination. The other can be you can attach a LED light onto your slit lamp for background illumination. You can purchase these LED lights from Amazon, and then you can have a light diffuser installed onto your in front of your mirror. These are the diffuser which comes with the slit lamp. If you don't have a diffuser, don't worry, you can use butter paper, and you can cut a slit in that and apply the butter paper here, and the light will be you'll have a background illumination, a diffuse illumination. So this is diffuser applied in front of the mirror, and this is without the diffuser. And this is a photo taken with a diffuser in front of the mirror. So in conclusion, slit lamp photography has emerged as an invaluable tool in ophthalmic diagnostics and documentation. It enables clinicians to capture detailed images of the anterior segment of the eye, and as technology continues to advance, we can anticipate further enhancements in the imaging quality and accessibility. Thank you for your patient listening. Yes, Dr. Shah, please. Sorry? Yes, they are either the beam splitter is either in the front of the right eyepiece or in the front of the left eyepiece. Most of them are the left or the right? Right. I have two slit lamps by Topcon, and both of them they have a beam splitter focus in the right eye. Yeah. Yeah, my right, but patient's left. Yeah.
Whole thing, what you are seeing on the screen is never seen by the eye. Because the reason is, except Harkstreit, I think, most of them are on the non-dominant eye. That is what they want, because the maximum light should go into the dominant eye.
Yes.
So what you are seeing today on a slit lamp is never seen on there. You have to move it in such a way that your vision gets blurred, but that side is good. So what we need is a device where we can interchange it.
Okay.
At present we don't
I think
have.
that would be that's a wonderful idea.
We don't have, at present we don't have.
Yeah. So if it can be something like DSLR mirror cameras, wherein when you click, the beam splitter comes in front of the both eye and goes away. Can think on those terms.
Because we do not get that quality of pictures. When we see something, is usually not
seen on the screen.
Except Harkstreit.
Yeah.
But it is very expensive. It is around 20 lakhs.
20 lakhs, yes.
I tried to change the system, but they said you need to change the whole hardware if you want to go from left to the right.
Right.
And I have both of them, and I found that the right side, because 90% of the people are right dominant. And when you keep the beam splitter on the right dominant, your amount of light entering into the right eye, which is the dominant eye, reduces. That's why they kept it on the opposite side.
So, as far as I remember, I have two photo slit lamps by Topcon, and in both of them, it's the right eye which has the. I'll just confirm it. I'll still confirm it.
Sir, I want to add something.
Yes, sir.
So, since we made a DSLR adapter, it can be adapted to the right or to the left.
Okay. So
no issues, no issues. But only thing is, we need to have a beam splitter which has got 2 ports. Okay.
Yeah.
So when you have got 2 ports, we already made 2 ports. We already provided a couple of adapters to people. So it is their choice which dominant eye, which is their dominant eye. If they are comfortable with the right, they can use it for the right or for the left. And we have been able to do the imaging with
imaging
that.
better. Yeah.
So even mobile adapters are also available, which are quite handy.
Yeah.
So that also can be moved between right and left, because if you have got a mobile adapter, it can rotate by 360 degrees.
Yes.
So whichever direction you want, you can fix it, and right and left is not an issue now. We can handle it.
Satish sir, we start with your presentation, and we'll take all these questions in the end.
Yes.
Yes. Can we switch over to the